Hello, everyone, and thank you for joining me today. I'm Chip Wagar. I'm one of the founding directors of the Patient Rights Advocacy Forum here in Louisiana. And I want to talk to you about one of the most persistent myths surrounding medical malpractice law in Louisiana. A myth that's repeated again and again, but it's simply not true. And here it is, that without Louisiana's harsh and outdated medical malpractice laws, the most draconian in the country, doctors and healthcare providers would leave the state and our already fragile healthcare system would collapse. Now, this fear-mongering idea suggests that protecting the rights of patients would scare away healthcare workers. But let me be clear, this is a myth. Let's look at the facts. According to the most current national data from objective medical industry publications, like Becker's Hospital Review, the states with the best doctor-to-patient ratios are Washington, D.C., Massachusetts, Maryland, New York, Rhode Island, Connecticut, Vermont, Pennsylvania, New Hampshire, and Oregon. Now, here's what's important. A few of these states have damage camps on malpractice, but most of them don't. They don't have any medical malpractice damage camps at all. There's no pattern that links caps with physician supply. In fact, several southern states with no medical malpractice caps, like Georgia, Alabama, and Florida, are home to some of the nation's top hospitals, including Emory University Hospital in Atlanta, UAB Hospital, University of Alabama at Birmingham, the Mayo Clinic in Jacksonville, Florida, Tampa General in Tampa, Florida, Shands Hospital at the University of Florida. These high-performing institutions operate just fine without medical malpractice damage caps, and they attract and retain talented doctors. Doctors are not fleeing Florida or Georgia or Alabama because they have no medical malpractice damage caps like Louisiana. Now consider this. Mississippi, with a $500,000 cap, ranks dead last for primary care physicians, just 70 per 100,000 people. Texas, which also has caps, is the 7th worst in the country. So let's ask ourselves, if caps are supposed to keep doctors in state, why are states with caps struggling the most? And what about Louisiana? We have roughly 80 primary care physicians per 100,000 people. That's well below the national average. Even worse, 60 out of 64 parishes in Louisiana are designated health professional shortage areas. That's almost the entire state. Caps haven't solved our shortages. Caps haven't helped Louisiana's access to health care. It's a myth. And the next time someone comes up to you and tells you we can't do anything about Louisiana's harsh medical malpractice laws, tell them to look at the facts. Don't take my word for it. Look it up yourself. You'll find what I'm saying is absolutely true. It's a myth. We need to change Louisiana's medical malpractice system. The Patient Rights Advocacy Forum is trying to do just that. We want to introduce legislation in the legislature next year to change the law in Louisiana, to bring it up to date, to raise our medical malpractice caps, and to help patients. Because you see, what all this has done is to impact the most catastrophically injured people, victims in our medical malpractice system. People with medical injuries that are trivial or frivolous aren't affected by caps. The people who are affected by caps are the paraplegics, quadriplegics, amputees, brain-damaged babies, and other catastrophic injuries, including death. That's who medical malpractice caps affect. We need to do something, and here's how you can help. Go to our website, patientrightsla.com. Contact your legislator. We have a page, and you can easily find out who that is and how to email them. Tell them it's time to change Louisiana's draconian and brutal medical malpractice laws. Thank you very much for listening. I hope this has shed some light on a controversial but false myth that is propagated by the medical industry to keep things as they are. And we'll talk to you again soon.